Fox 5 News with the latest on your health and medicine.
Oh, my aching back is a common complaint these days. Back pain is one of the most common health problems in the U.S.
I'm having it right now. More than half of us have been through it at one time or another. So how do you get relief? Fox 5 MEDTEAM reporter Beth Galvin goes in search of some answers in her special MEDTEAM report. Beth?
Roy and Lisa, back pain can be caused by anything from a minor ache to a serious condition that makes everyday tasks impossible. It can be triggered by an injury, by arthritis, and by a whole course of other problems. But there are some ways to find quick relief. Ann Stozier is pretty sharp at bridge.
Pass.
Pass.
3 times. Pass.
But the retired Norcross accountant has been dealt a bad hand when it comes to her back.
Unbelievable pain. It really is.
The slightest wrong move, excruciating pain.
And it's kind of like a Charlie horse. It pulls in the lower part of my back and pulls all the way across my back, and then I can't move anymore. Well, that's it.
But Ann is finding relief one needle at a time. The first time she came here to Metro Pain Center in Atlanta, her back was spasming so badly she could barely walk.
She put a needle right there, and within about, I'm going to say 5 minutes, I was able to stand up straight and walk out of here without using my cane.
And acupuncture is winning over many doctors as a way to heal unexplained back pain, even when nothing else seems to work.
Acupuncture is about healing from the inside out.
Licensed acupuncturist Mark Lewinter uses hair-thin needles he warms to open up what he says are energy blockages in the body, increasing the flow of chi or healing energy. The needles cause a rush of endorphins, the body's natural feel-good chemicals.
Acupuncture doesn't cure all cases, but what's nice is that it can cure many cases in a non-invasive and safe way.
I just think anybody who has chronic pain ought to at least try it so you can get off of painkillers and muscle relaxers.
Back pain is a big problem.
Back pain is the #1 reason patients come here to see Dr. Patricia Baumann at Emory's Pain Clinic. Sylvia Hershner has been hurting since she fell down a flight of stairs years ago.
That has been excruciating. I have gone from one pain medication to another.
Sylvia has what's called failed back syndrome. After 2 spine surgeries, she has lots of scar tissue.
The scar tissue causes compression and traction on the nerves, and so they have pain that typically is in their low back and radiates down their leg to their foot.
But a new implantable device called a spinal cord stimulator may help Sylvia. It delivers a low-level electrical current to the area of her spine that's causing her pain.
What it does is create a sensation of tingling in the area of their pain. And that sensation of tingling can block the pain impulses.
This allows Sylvia to control the level of her stimulation. And so far, it seems to be working.
My activities have been limited, but I would say I have gotten 85 to 90% effective pain control.
Incoming, newlywed Mary Ann Hunt is finding relief for her back pain another way.
I was in so much pain, I was crying like every night.
So Mary Ann turned to Forrest Watts, a doctor of chiropractic. 4 times a week, he adjusts and realigns her spine to take pressure off the nerves and give her some relief.
When it pops good, it's just like, and then it's done.
We gently place our hands on the vertebrae, making, through some gentle force, move the vertebrae off the nerve.
To be honest, for me, it took some getting used to. I was in such pain that, you know, I'd try anything at that point. But after the first couple of times of doing it, I could start feeling the pain, you know, releasing.
Mary Ann has a curvature of her upper spine and degenerative disc disease in her lower back. So Dr. Watts says he can't promise a quick fix.
It's going to take a few adjustments, 18 probably to 24 treatments, to actually get the vertebrae off the nerve completely and retrain to hold its positions.
At this point, I've been out of pain for the most part, more than I have in the last 3 years.
Most back pain eventually goes away on its own, but Roy and Lisa, if someone has been in pain for more than a couple of weeks, or if the pain is really serious and debilitating, you need to get in and see your doctor, because maybe your doctor can refer you to a specialist who will be able to help you. You don't have to live like this.
Something other than having to take pain pills.
Yes.
All right, Beth, thanks.